Welcome to the Visceral Voice Podcast. I am your host, Christine Schneider. Every 2 weeks on this podcast, I talk with voice specialists, manual therapists, health specialists, psychotherapists, movement practitioners, and professional voice users about voice science, function, medication, movement, puberty and aging, and everything in between. I am on a quest, not only to become a better manual therapist, but also to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, and a manual therapist. Join me every 2 weeks as we strive to provide current, knowledgeable, creative, and compassionate information to help restore, regain, and create happiness and success in your vocal journey. Christine Estes is a speech-language pathologist who specializes in the treatment of voice disorders, including phonotraumatic injury, neurological voice disorders, upper airway disorders, and care of the professional voice. Christine developed an interest in the anatomy and physiology of the voice while earning a bachelor's degree in vocal performance from the Crane School of Music and a master's degree in opera performance from McGill University. To further her knowledge of the voice and voice disorders, she earned a master's degree in speech-language pathology from Hofstra University, where she later returned in the role of an adjunct instructor of voice disorders. She is involved in clinical research for the Sean Parker Institute for the Voice, and several of her studies have been published and presented at international conferences and educational programs. An experienced performer, clinician, educator, researcher, and presenter, Christine enjoys being an active part of the medical and performing arts communities, collaborating with performers, voice teachers, and medical professionals to foster a multidisciplinary approach to vocal rehabilitation. Here you are, my conversation with Christine Estes. Hi, Christine. Thank you so much for joining me on the podcast.
Hi, Christine. Thank you for having me.
It's like Christine squared. This is really exciting.
It sure is.
I'd love to start with you just telling us about your journey into becoming a speech-language pathologist.
Oh, yeah. Well, for me, speech-language pathology is actually my second career. Originally, I was on the path to becoming a professional classical singer, and I found music really at a very young age. As a child, I was very shy, but I was always singing and I was always learning through music. And in some ways, I kind of found my voice as a musician. So in pursuing a singing career, an undergraduate degree and a master's degree and lessons and coachings, auditions and shows and concerts and travel, after a while, I started to become very discouraged by the competition and some of the negative aspects of the business side of music. And for me, it kind of made me not love music anymore in some ways. And at the same time, I had a temp job in a hospital communication disorders office. And that's where I learned about speech-language pathology. And I learned that treating voice disorders was this subspecialty in speech-language pathology. And I thought, well, that's interesting. Maybe one day I'd like to look into that. And I just found it fascinating and wanted to learn more. And suddenly there I was with this new interest, and I found that I was becoming more passionate about helping other people with their voices than being on stage myself. So I went back to school and I worked really hard, and I really haven't looked back since. And luckily for me, I rediscovered my love of music again. I rediscovered my love of singing. But now my passion is helping other people get there and helping other people stay there. So I love what I do as a speech-language pathologist. I'm constantly challenged. I'm constantly learning. I get to collaborate with brilliant doctors and voice teachers and other speech pathologists and professionals like you. And I get to make connections with incredible people every day.
That is so wonderful.
Thank you. I'm very happy with where I ended up.
Yeah, and you're at the Sean Parker Institute for the Voice?
Yes, I am.
In New York City?
We're part of Weill Cornell Medical College, and part of the ear, nose, and throat, the ENT department there. But we're our own specialized voice institute. We have 3 laryngologists, and which are ENTs that only specialize in voice. So they're ENTs who only do the T. And and we have 4 voice therapists at this time, and we specialize in treating individuals with voice disorders of all types. A big portion of our population is professional performers.
That is so great. You specialize in treatment of voice disorders, and that includes a number of different things, but it does include phonotraumatic injury. Can you explain and give some examples of phonatory and non-phonatory traumas?
Sure. Well, phonotraumatic injury encompasses a wide range of different types of voice problems. Many of the phonotraumatic injuries are things we hear a lot of myths about. So there are things like nodules and polyps and hemorrhages, and none of these really are career-ending injuries, but they all pose different types of challenges to performers, and they all require different types of treatment that can range from voice rest to medication to voice therapy or to surgery. And so some of these are caused by phonatory traumas like heavy voice use, a lot of loud voice use, too much voice use. So we sometimes call it too much, too loud, too often. Sometimes there may be a technical issue, like performing with, improper technique. But some of these injuries are also caused at times by non-phonatory traumas. So in more rare instances, there could be a lot of throat clearing or very heavy coughing or even weightlifting that can place a lot of strain on the vocal folds. And there are other types of injuries that we treat as well that aren't caused by voice use at all, like nerve weaknesses or nerve misfirings. So there's really a broad spectrum of voice injuries out there that we treat.
I love too much, too loud, too often.
It's
How
true.
often have I seen that with some of my clients, with some of my friends? They're just doing so much. They're doing their Broadway show and they're doing all these additional readings, and all of a sudden they have some edema or some kind of pathology, and then they're put on some prednisone and they think that their voice is back and they're singing even more. And then all of a sudden they have a true voice pathology, because they've done too much, too loud, too often.
Absolutely. And, a lot of the people who come into my office, a lot of the patients who are referred to me will say, well, I think I'm too loud. I think I'm too social. And I say, well, voice pathologists tend not to see wallflowers. We don't see the wallflowers in our office. We see the heavy voice users in our office. There's a reason these things
Mhm.
happen.
Yeah. Yeah. And, another reason why I wanted to ask you this question is because I think a lot of people, at least when I was not a therapist and singing professionally, I didn't really think about a lot of the non phonatory traumas. I had a very heavy laugh,
hmm
and my laugh was really affecting my
Oh,
voice.
it definitely
And so I,
can.
I actually had to look at how to calm my laugh down so that it wasn't causing negative effects or inflammation
I find that to
on
be
my
one of
cords.
the most challenging things that we have to do sometimes in voice therapy is help somebody modify how they laugh. I mean, think of
Mm.
something that's so primal and so natural to somebody, and then saying, well, actually, the way you're laughing is really hard on your voice. So we're going to teach you a completely new, healthy way to laugh now. It's kind of like, changing your walk or changing something that's just so natural to you. It's really
Right.
challenging.
Yeah. Well, I'm selfishly glad to hear that I am not the only one who has had to modify my
You are
laugh.
not.
And so I saw online on the Facebook that you did some research with the vocal health of fitness instructors. Is that
I
correct?
did. I did. I became really passionate about that population, and I still am.
I love it. I would love to hear if you can tell us more about the research.
Yeah, well, it all started because I kept noticing that I was seeing more and more fitness instructors on my therapy schedule. And as I was meeting them, I noticed that a lot of them were coming from the same studios. So it got me thinking about the fact that it's total common sense that a fitness instructor is going to be using his or her body very extensively, and that an instructor would stretch and condition and warm up the body in a really healthy way to be able to demonstrate physical exercise effectively. But what we might not think about is that they're also using their voices extensively to teach, often while they're demonstrating that physical exercise. And they may not know how to use their voices properly to do that. And not only that, not only are they teaching or they giving verbal instruction, but they're motivating us to push ourselves past what we feel our physical limits are. So when we're in there trying to get a good workout, they're using their voices to keep us motivated so that we get a better burn. In a way, that's a performance.
Definitely.
Yeah, it definitely is. I mean, they're performers doing this. And I decided to look into some of the existing research on voice use in fitness instructors. And I found some really interesting surveys, most which were done by a speech pathologist in Australia named Anna Rumbach. And the surveys showed that about 70% of instructors were having major voice problems even after teaching one class, and that they really wanted help but didn't have access to it. And despite the fact that most studios provide microphones nowadays, a lot of the instructors were saying that they were pushing their voices anyway because they didn't have training to teach them how to balance physical activity and the voice, or how to use a microphone properly in a really noisy setting, because the settings for fitness have loud music, loud equipment, usually not ideal acoustic conditions. So it's a lot of noise to try to push one's voice out over. And I found some good studies too that showed how physical exercise and voice use combined puts a lot of pressure on the vocal folds, and how even after teaching one 60-minute class, instructors were speaking at a higher pitch and were speaking more loudly, and they retained that for a while after teaching. So that's a lot of force on the vocal folds that they're carrying out even when they leave the teaching environment. So in our study, I found 25 fitness instructors, and 24 of them had some sort of phonotraumatic injury. So here
Wow.
are 25 people who came into our office because they were having a voice problem, and 24 of them had a lesion on their vocal folds of some sort.
Mm.
So that alone is a big deal. And these injuries ranged from nodules to pseudocysts to polyps. And for anybody listening who needs clarification on what those things are, please take a look at our website, which is voice.weil.cornell.edu. We have a nice detailed explanation of these with pictures of each. But back to the study. The main complaint that the fitness instructors were coming in with was that it was more difficult to use their voice, that it took more effort, more vocal effort to talk, and that they were experiencing hoarseness after teaching. So when I asked why did they think this was happening, the reasons kind of fell into a few categories: that they didn't have reliable amplification, that it was maybe poor quality or it kept breaking down, that they didn't have training to use their amplification properly, or that they were scheduled for too many classes in a row, or a combination of all of these things. But a big surprise to me was that more than half of the fitness instructors we studied were also trained performers. So
Ooh.
these were all people, yeah, these were all people with voice training. They had taken voice lessons, and some were still taking voice lessons. So they were teaching fitness as a survival job. And it really goes to show that voice training in one context for singing or for acting doesn't necessarily cross over to another context like teaching fitness. So if the survival job is hurting the voice, then ultimately it's really jeopardizing their chance at a performing career too.
Right.
Yeah.
I see that a lot. And I have a lot of clients come in and say, I actually think that it's my speaking voice. It's all of my speaking lines. My voice feels fine. My singing feels fine. But my speaking voice, I'm like, yes. I mean, we don't often think about how we speak, but we do think about how we sing.
It's true. And I think it's because we think about singing as this, very separate, special thing that requires a lot of training. And singing is special. But when we first start speaking, I mean, we're speaking at such a young age. We're speaking because we want comfort, or because we're hungry, or because we need our diaper changed, or something like that. And we often
Survival.
survival, exactly. And so we don't often think about, well, how am I using my voice? So when a patient comes to me, it's often to them a really big surprise that maybe it's your speaking voice that's the issue here. And once we break it down and find a healthier way for them to speak, or find ways to just use the voice differently, it can be such an eye-opening experience. And so I'll often ask them, is your speech supporting your singing? Think about that. Is the way you use your voice in your day-to-day supporting your career, or is it pulling you away from your career?
And so, with the demographic of fitness instructors, can you give us some examples of what vocal care would look like for them?
Yeah, that's a hard question to answer, because there really is no one size fits
Yeah,
all
I'm sure.
for professional voice users. I certainly don't think so. Even with all people within the same profession, we're all unique individuals. We have different bodies and different experiences and different skills, but there are some things that are fairly universal.
Great.
One is one is just making sure that you're taking care of your body, because that is your vocal instrument, that you're well hydrated, that you're healthy, that you're getting enough sleep and eating well, that you're controlling things that can increase likelihood of voice injury, like allergies, like reflux, and really taking the time to examine how you're using your voice each day, knowing that if you are in a vocally demanding profession, if you're a fitness instructor or a singer or teacher or lawyer or preacher or telemarketer, that your vocal health is essential for you to be able to do your job and to do it well.
Mm.
Sometimes it takes looking at what we're doing socially. So, for me as a voice therapist, I need to be in good vocal health so that I can demonstrate good behaviors to my patients. If I go out to a noisy restaurant with friends, I think about ways to keep myself from pushing my voice too much. So, I'll listen more than I talk, or I might find a quieter spot in the restaurant. I'll use strategies that I teach my own patients to protect my own voice and, overcome noise in a healthier way. Because ultimately, we're relying on these two tiny vocal folds that withstand a lot. They vibrate hundreds of times per second, and sometimes they need some recovery time. So I like to think of it as budgeting your vocal cash,
Mm.
that we start off each day with a set amount of cash. And if we know we have to spend a lot of it in one place, so if it's a performing day, a lot of that cash is going into the performance. So we have to budget our voice use elsewhere. We might not want to have a 2-hour phone conversation. We might not want to have brunch in a noisy restaurant. We really have to kind of look at everything and plan for the most important way we're going to be using our voice.
I love that. Budgeting vocal cash. I'm just going to say it again for everyone. Budgeting vocal cash. That is so brilliant. What a brilliant concept.
When we gave a seminar for fitness instructors, my colleague Scott turned it around and he said, planning your vocal calories. So he
Ooh,
kept talking about it
okay.
in terms of desserts, which I thought was wonderful. So he kept talking about where you're going to use up your calories and then where to cut back on some calories elsewhere. But I tend to go back to the cash.
Yes, I like both of those. I think they're both really beneficial to hear. Great. And so, something that I love that you said, and something that I really want to get across on this podcast, is that professional voice users, there are so many different professions where you are a professional voice user. And if the listeners don't get anything else out of this, it's that fitness instructors, preachers, you mentioned several of them, sports broadcasters, they are also professional voice users or vocal athletes. So I think it's so important because sometimes you don't, tour guides, people don't necessarily realize that they need to take care of their voice like they would take care of their body, and that they use their voice so much in their profession, and then they don't really realize that they are professionals in the field as well.
Absolutely. And they're often professional voice users. And in those professions, they may not have voice training at all on how to use their voices. So it becomes, even that more risky. I know where I went to undergraduate school, the Crane School of Music, most of the people I graduated with are music teachers. And so around this time of year when when they're kind of nearing the end of the school year, but there are a few months left, and they're all feeling very vocally fatigued. Many of them reach out to me and they go, "What can I do? What can I do? I just have to get to the end of the school year," because they are vocal athletes just as much as a performer is. In fact, teachers tend to get hurt more than any other profession. So if you ask people what profession gets hurt the most, a lot of them think it's the performers, but often it's actually school teachers.
Mhm. That would absolutely make sense to me. So, are there some alternatives that you could recommend that fitness instructors could take while they're working in the classroom?
Oh, so many. There's
Great.
so many things that can be helpful. One thing is simply trying to keep the noise level lower. So, if you have some control over the loudness of your music, you know, bring it down maybe a little bit lower than you think, and you're going to be less likely to push your voice so loudly. Actually, there are some studies out there that showed that really, really loud music is not necessarily as motivating to students as we might think. And in addition, it's actually putting them at risk for hearing loss.
Mm,
So,
so true.
so keeping just the noise level lower is beneficial for the fitness instructor and beneficial for the student. Another suggestion is making sure to use your microphone properly. So I found that when I went into the studio, some instructors had their microphones really close to their mouths. And instinctively, it makes sense, right? If it's close to your mouth, you're going to expect that you'll put out a louder sound. But actually, it made their sound very muffled and made it more likely that the students wouldn't be able to hear them well and then would ask them to repeat instructions.
Mhm.
So, for many of the headset microphones, the optimal distance seems to be placing it about 2 finger widths from the corner of the mouth. But you should really check the specs for the amplification system you're using so that you know for sure. I also found that a lot of instructors I worked with were using a lot of unnecessary filler talk. They just wouldn't stop talking. And I get that it can motivate students to push themselves, but it can also be over the top and unnecessarily vocally fatiguing. So I suggested that they simply reduce their voice use, that they talk less, and ultimately, this can be more helpful to your students because then your students have the opportunity to receive the information you've given them and then process it without becoming confused by extra talk.
And pay attention to their own body and their own body mechanics and their breath by giving them the space and the time and the silence to be able to do that, I would imagine.
Absolutely. Just being able to hear it, process it, breathe, and then really focus on their awareness of what they're doing and how they're moving in space can give them a better workout than just trying to yell and yell and yell and say, "Go for it, go for it, go for it," and pushing and wasting your own voice.
Mhm.
I also suggested for many of the instructors alternating giving verbal direction and physical demonstration so that the two aren't always going on at the same time. We know that talking while physically exercising increases pressure on the vocal folds. So if we alternate that and don't do so much of that at the same time, that can decrease some potential for excessive pressure on the vocal folds. And it can give the instructor an opportunity to just breathe. Any opportunity to just breathe and just pause and take a break gives
Mhm.
the voice a rest too, and the brain a rest.
Yes.
So I'll even say just have a bottle of water and sip on water during class. It gives you a chance to stop talking. It gives you a chance to hydrate, and it gives you a chance to reset yourself, to reset your voice. And you happen to be giving a really nice example for your students about the importance of hydration as well.
Mhm.
Now, if I'm seeing a fitness instructor for voice therapy, it's a bit different. So it's not just about preventing injury, but now it becomes about working through injury and trying to recover from injury. So we work together to create a set of warm ups and exercises to complete before and in between classes. And these types of things can be very simple. They don't have to take a lot of time, but they calibrate the voice to set up healthy voice use, just like a singer would do exercises to warm up his or her voice. So, again, while I don't believe in a one size fits all warm up approach, there are some things that help a lot of people, like just some gentle humming or something that we call lip trills. A lip trill exercise can be very helpful too. And then other ways to just reduce voice use. So, ways to cue changes in movement instead of relying on the voice, like an electronic noise signal or a whistle, even an air horn, anything that doesn't require the voice. So, one of my instructors, who's this really fun person with this amazing energy, he found this fun way to incorporate pre-recorded instructions into his song list. So he plays his music and there are instructions that just come through and he doesn't have to say a word, and his students love it. They know when it's
Wow.
coming. They chant it out loud along with his recorded voice. It's hilarious. So it really tells you a little creativity can go a long way, both in motivating your students and in reducing the demand on your voice.
That is so great. For any of our listeners who might be outside of New York City, maybe they are a fitness instructor or any professional voice user, but since this is sort of geared around the fitness instructor and they're having a hard time, they're feeling some hoarseness, some fatigue, do you have recommendations of what they should do? What are their first steps? Where should they go? Who should they reach out to?
Absolutely. The best thing to do, if it's something that you can't really explain through, say, having a cold or having allergies, and it really seems to be related to how you're using your voice, the best thing to do is get scoped. Go see an ENT, again, preferably a laryngologist, and just check out what the vocal cords are doing. Make sure that they're healthy, make sure everything is okay. There are places to look online where you can find laryngologists. I forget what the website is. Oh,
We'll try to find
yes,
it and post it on the notes.
yes. But not everywhere has a voice center, but many do. Additionally, if you go to our website, we have that seminar that we gave. Actually, we have it where you can download it and watch the whole thing. It's a good 2-hour seminar with a lot of really helpful information. So that's for free on our website, and that might give you some tips on some things to try if it's maybe not a chronic issue yet. But if you're having chronic hoarseness, you're having chronic voice problems, the last thing you want to be doing is pushing your voice through it and potentially making it worse. So, seeking a voice evaluation with a laryngologist really is one of the best things you could possibly do.
Great. So now I go into what I call my rapid fire questions, which I ask every guest.
Okay.
So the first one is, what is some advice that you would want to give to an aspiring performer?
To an aspiring performer, oh my goodness, I have been in those shoes. I would say to start off, this is not so much about the voice, but it's about attitude. You have to remember that your journey is your own. And the more you keep your mind on that, instead of comparing your journey to someone else's journey, the more focused and positive you will be. The path that brought me to my career as a speech language pathologist was not a straight line, and it's not at all what I expected. But here I am, and all of the things I went through in the past are part of my story. So you have your own story to tell, you have your own path to follow. Stick to your path and see where it goes. But if I'm going to be specific about the voice, okay, I would say recognize that your voice is a dynamic instrument. It's part of your body, and your body is always changing. So, if a performing career is your goal, it's important that you keep your voice healthy, as we said, including both your singing technique and your non singing voice use, your day to day voice use, your social voice use. Where I often see people getting hurt is when they're on tour and they're physically fatigued, and after a while they just stop warming up. Or another scenario is when someone books a show and then stops taking voice lessons. And that just makes me go, oh my goodness, why are you doing this? Because the eyes and ears of a professional voice teacher are just so essential. It's such an important investment in your career success. So I say, once you land the gig, don't stop learning, because your body's always changing and your technique may change too. Now, my voice therapy side also wants to say, if you happen to experience a voice injury, don't panic. Okay, seek help from the proper professionals, especially a laryngologist, because voice injury is much more common than people think. And there are many professionals out there who can be part of your team to get you back on track. And then once you are back on track, if your friend or your colleague is experiencing a voice problem, you're in this amazing position to help them seek appropriate care, to open up about your experiences, to tell them that this is not going to end their careers, that this is not going to ruin their lives. The more we talk about these things, the less stigmatized they become. It takes away the fear, it takes away the myth, it takes away all the smoke and mirrors. We know professional athletes get hurt, they have physical injury, and that doesn't mean that they're bad athletes. It means that they play hard and they play a lot. Vocal performers are vocal athletes, and voice injury is an occupational injury. It happens.
I love that you brought that up. I love that you said all of that, because the amount of people who feel so incredibly alone, I tell client after client after client, I have an entire practice based on, not everyone is injured. I do a lot of maintenance work too to keep people healthy on stage. But a lot of my clients do have something going on. And I say, you're not alone. I have an entire practice on this. I have so many friends who are speech pathologists who have entire practices on this. And we're here. We're here to help you, and you are not alone.
It's so true. I mean, as I said, we have 4 speech pathologists in our Voice Institute alone. We are all treating voice disorders all day long. We're very busy. You're definitely not alone.
Yeah, yeah. Thank you for saying that. Okay, so what has been your greatest professional achievement?
I don't know if I have had anything I would call my greatest professional achievement. I think that's still coming, and I don't know, I try not to look at anything as a major success or a major failure. So I just look at little mini successes, little mini happy moments, and then small areas to grow. So for me in my day to day, just balancing a commute and keeping my patients educated and healthy, and having an opportunity to be involved in research and outreach, and then still being able to come home and read to my kids at night and tuck them in, that feels like a big deal to me. But
Mm.
so it's little things that make me feel successful. But I will say, as a professional voice therapist, something that gives me a ton of satisfaction is when I have a patient who comes in and is really doubtful of the therapy process. And as we work together, that person starts to feel and hear real results and becomes a believer in the process
Mm.
and realizes that they have ownership of their voice and that they can control this, and that they've become their own voice therapist in a way that suddenly it's not about what I'm imparting to them, but they're doing it. And
Yes.
that's an amazing feeling. It gives me incredible satisfaction. Or if I'm working with a performer and we finish therapy and that person books an incredible gig, it makes me so proud to know about their success and to know that voice injury didn't derail their goals. That's huge to me. So when that happens, I'm proud of the work that we've done. I'm proud of the work that they've done, and that makes me feel successful.
Yes. All of that sounds like phenomenal professional achievement to me. And as someone who also is dealing with a commute and getting home to tuck my daughter in at night, and so many times it's not necessarily that it's one big flash exciting event. It is the little events that add up, that add kind of to true happiness, or true success.
Absolutely. Sometimes when you're juggling a lot of balls in the air and they don't all fall down, that feels like a wonderful success.
Yes, definitely. And on the flip side, what do you feel has been your greatest professional setback?
Yeah, I I can't say that I've had anything that I would call a setback, at least not as a speech language pathologist. My singing career definitely went awry, but that led me here. So I can't even call that a setback. I,
Mhm.
I worked hard. I keep working hard. I'm always learning. I've been very lucky, and I just keep going through my day to day to see where my career goes. So I can't really say that I've had any professional setback. I hope that's not to come, but we'll see.
It's not. It's not.
Sometimes, sometimes we learn from failure too. It's not all about achieving things. Sometimes we have to fail in order to find success. So who knows what's coming?
What do you wish you would have learned sooner?
Well, there are two things that I can think of that I wish I had learned sooner. One is that in order to be a good voice therapist, my job is to help my patient find the voice that they want within realistic expectations. So, my job is not to make everyone sound like what I think their best voice should be. And that took me some time to understand. I was in the beginning of my career seeing patients and really trying to mold their voices into what I thought they had potential for. But it's not about what I want for their voice, it's about what they want for their voice. And I had to learn that and understand that. It's not about what I want them to sound like, but what they want to sound like. So even still, sometimes I have to keep that in check sometimes. And then the other thing I wish I'd learned sooner was that singing for musical theater, which is the primary population of what we see at the Parker Institute, that type of singing is not bad technique. And I tell you, there are healthy and unhealthy voices in every style of singing. But I came out of my classical training with this thought that singers on Broadway are all pushing their voices and that they're all singing with terrible technique and that belting is bad and everything about it is bad. And once I started really working with that population, I learned that that's really not true. That they're performing 8 shows a week and they're dancing and they're having rehearsals on performance days. And those are things I never encountered as a classical singer. Those are things that don't really happen in the classical world. So it's not comparing apples and apples. So I wish I had never had that thought. Now I see how hardworking my Broadway singers are and go, what in the world was making me think that none of them have technique? It's so untrue.
I completely understand this.
Do
I
you?
am also classic. I've my degree in voice as well. Though I did do a lot of music theater and I knew that I wanted to do music theater right away. But coming into being a music theater artist and doing 8 shows a week, because my professional career was in music theater, and getting to a point where I was doing 8 shows a week for, for 3 years in a row, it's really hard. All you're doing all day long is taking care of your voice so that you can do your show that night. You're taking care of your body. You're giving yourself rest so that you have the energy to have that adrenaline rush and use all of your cortisol at night. Because if you use it up during the day, just like you said, budgeting vocal cash, it's kind of budgeting overall
It's
overall health
definitely,
cash.
definitely budgeting overall health cash. It is unlike any other profession. It is so challenging. And I have a wonderful patient I'm working with, and he's dating somebody who's not a performer, and she doesn't understand why he won't go out after the show and go out for drinks and meet up with her friends. And he keeps saying, well, I need to rest. I have to save my voice. I have to rest my body. And it's really hard for someone who doesn't live in that world to fully grasp that, the entire day, the entire week is devoted to keeping healthy enough to get through that show, especially on those 2 show days that are just so difficult. I don't even understand how everyone is able to do it. It's incredible to me.
It is, and especially in certain shows.
Definitely. Some shows are more difficult on the voice than others,
Yes.
and difficult on the body than others.
Yes, for sure. So, if any of the listeners would like to learn more about you and what you're doing, what is the best way that they could connect with you, Christine?
Sure. There are quite a few ways. And one way is to go through our website, which is, again, it's voice.weil, WEILL, .cornell.edu. We also have a Facebook page with a really long name. It's Sean Parker Institute for the Voice Weill Cornell Medicine. Or feel free to follow me on my Twitter account, which is Voice SLP Chris. I try to keep the focus of my tweets on voice research, voice education, and voice news. Occasionally, I'll have a ridiculous post or retweet, but I keep it light and fun and vocally informative, and I hope helpful. My colleague, Dr. Sadugi, also has a professional Twitter account. So he posts a lot of medical and surgical information. So between the two of us, we really cover medicine, surgery, and behavioral issues when it comes to voice. All of us at the Parker Institute love to educate and connect with people. So please feel free to contact us through any of those means. Feel free to attend any of our voice events. We host a number of seminars and webinars each year, and we're always trying to put things out there. So if you have any ideas of something you would like to learn about, or something that you think warrants some interesting discussion or education, please share ideas with us, because we'll respond to that and we'll probably create a webinar or a seminar about it within a few months.
That is so great. It has been such a delight to talk with you. Thank you so, so much for joining me on my podcast and helping us learn more about the voice.
Thank you so much for inviting me as a guest. I think what you're doing with your podcast is wonderful. It's such a great resource to professionals of all sorts, whether it be vocal educators, teachers, speech pathologists, singers. but also thank you for everything that you do. I don't know if your listeners know how we met, but it came up where I was seeing so many patients who kept mentioning your name. And I thought it was really funny because they would come in for voice therapy with me and they'd hear Christine. So they would think that I was the Christine who did the amazing voice massage. And even though speech language pathologists are trained to do some types of laryngeal massage, it's not nearly to the extent of what you do. So they would come into me, think they were getting a vocal massage, and then they'd go, well, wait a minute, what about the Christine who does that? And then I would just get such incredible feedback from some patients about the work that you did with them. And when we finally had an opportunity to meet and talk shop, I just fell in love with the work that you do. And I think you're an incredible resource to anyone who has a voice, but especially to performers. So thank you for everything that you do for the people I work with.
Thank you. Thank you so much. It's such an honor to be on your team. I have certain teams that I feel like I'm on, and I definitely feel like you and I are on a team, and I really appreciate that.
Christine squared. We're definitely a team.
Yes, there it is. All right. Thanks again.
Right. Thank you.
Thank you all for listening. If you enjoyed this podcast, please like us, tell your colleagues, your students, and your friends. Please subscribe, write a review, and find us on Facebook at Lifelight Massage. You can also check out my website at lifelightmassage.com. Join me in 2 weeks for a talk with body-oriented psychotherapist Zena Mersell.